Every person is a unique individual and born uniquely, and I have to work with the way the good Lord made you. I cannot make one person into another, and you'd be surprised how many patients actually come in with pictures of other people's noses and breasts and stomachs and say, I want this stomach or nose or breast. I can't do that. I have to work with what you have, and I could create something that's improved and better, and hopefully give some happiness to the patient, but I cannot create something entirely different. The people who understand that are the most comfortable and actually the happiest in the post-operative period. Examination is most important, and also getting to know the patient and getting to know what they're looking for is also important. I can't project my views onto the patient because I have to understand what they wish to have in their appearance. But I try to combine the two to give them what they're looking for, as well as offer them my expertise over the past 19 years and what I think might work out best for them. When a patient walks in here, we sit them down and I establish a rapport. I talk with them. I find out, we don't automatically start off and say, well, what would you like to have operated on? I get to know them. Tell me about your family. What kind of work do you do? I have to understand the background a little bit to know what might be best for them, and also it puts them in a great deal of comfort. The level of comfort is important. If they're not comfortable, they're not going to tell me what's inside their heart and soul, and I want to hear what's inside their heart and soul. Once we get them comfortable, then we get into the more specifics about the befores, what bothers them, how they've changed, if it's a younger person, what they're looking for, if it's an older person, what has happened with time as time passes on. Once the history is taken, of course, we do a full medical history and medical exam, then I'll examine a particular area the patient's interested in, their breasts, their stomach, their thighs and arms, their faces, their noses, or whatever. Once we examine them and come to a conclusion about what's best, then we can achieve and make a recommendation for them. Hopefully it'll segue into what they're looking for as well. There's a definite psychological change in them. The patients are happier. They're more confident. They get up and they could do things, whereas before they wouldn't have the desire to do them, or they feel they have the ability to do them. There's more social interaction. There's more of a living. They live better, they live happier, and they live more. I think the plastic surgery does have a tremendous psychological effect. I always used to joke with the patients that I could accomplish in 1 hour that a psychiatrist would take 20 years to accomplish. I mean, in some ways it's true. To look better, to feel better, to wake up and have beautiful breasts where a week ago you had a flat chest, it's a tremendous boost to a person. A tremendous boost. And it permeates everything. It permeates career success, social success. And it's something that when a patient comes in and tells me I have the confidence to go to this party or to that venue or to apply for this job, I like when I hear that. And I feel that there's a significant contribution to the patient's life, not just an aesthetic thing. And there's definitely a great impact on their psychological well-being. When I see a patient that's happy and whose lives have been, I hate to use the cliche, but whose lives have been transformed, it's one of the biggest gratifications that I get.